Welcome to Gonorrhea Testing, Treatment, and Guidelines Training video for clinical staff. After watching this video, viewers should be more familiar with 1. Updated testing age requirements for those requiring gonorrhea testing. 2. CDC-required NAAT testing. 3. Reporting. 4. Treatment, follow-up, and classification. 5. Turnaround times. Let's begin with the first learning objective. Updated testing age requirements for those requiring gonorrhea testing. The age group for gonorrhea testing can be divided into two categories. 1. All applicants aged 18 to 24 years must be tested for evidence of gonorrhea. 2. Applicants aged less than 18 years or greater than 24 years must be tested if there is a reason to suspect infection with gonorrhea. Now that we've covered the age group, let's move on to our next learning objective. CDC-required NAAT testing. Timing and location of testing are critical. 1. The gonorrhea nucleic acid amplification test must be ordered by the panel physician at the time of the immigration medical examination. Tests performed elsewhere or prior to the panel physician's examination of the applicant are not acceptable. There are also other factors to consider. 2. While gram stains on urethral secretions may be diagnostic in symptomatic men, they cannot be used to rule out infection in asymptomatic men or on other types of specimens. Therefore, gram stains are not accepted for gonorrhea screening in the immigration medical exam. In this segment, we will focus on the third learning objective, reporting. Specifically, if you are simultaneously testing for chlamydia, you'll want to treat and report both. Many gonorrhea tests automatically test for chlamydia trachomatis. Although chlamydia is not listed in the Diseases of Public Health Significance in 42 Code of Federal Regulations, Part 34, panel physicians may use test kits that screen for both gonorrhea and chlamydia if gonorrhea standalone test kits are unavailable. When combined test kits are used, applicants must be informed of results for both gonorrhea and chlamydia. In this segment, we will focus on the fourth learning objective, treatment, follow-up, and classification. Understanding the appropriate treatment approaches and classification system is vital for effectively managing gonorrhea cases. Several guidelines should be followed. Let's explore each aspect one by one. 1. Panel physicians must treat gonorrhea according to CDC's STI treatment guidelines. 2. Applicants who test positive for chlamydia only must be offered treatment in accordance with the CDC's Sexually Transmitted Infections Treatment Guidelines. However, the applicant is not required to take this treatment as chlamydia is not a Class A condition. If an applicant is tested for chlamydia, the results must be documented in the DS 3026 remarks section. 3. Applicants with untreated gonorrhea are Class A for gonorrhea and will remain Class A until treated. 4. After completing treatment, applicants are classified as Class B. Applicants diagnosed and successfully treated for chlamydia should receive a Class B other classification. 5. Treatment failure should be considered in 1. Persons whose symptoms do not resolve within 3 to 5 days after appropriate treatment and report no sexual contact during the post-treatment follow-up period. And 2. Persons with a positive test of cure, i.e., positive cultures greater than or equal to 72 hours or positive NAAT, greater than or equal to 7 days after receiving recommended treatment, when no sexual contact is reported during the post-treatment follow-up period. In this segment, we will focus on our final learning objective, turnaround times. These guidelines ensure that results are obtained in a timely manner, allowing for prompt diagnosis and appropriate intervention. NAAT test results should be available within 24 hours if testing daily. If batch testing is performed, NAAT test results should be available within 72 hours. In summary, you should now be familiar with the following gonorrhea testing, treatment, and guidelines. 1. Updated testing age requirements for those requiring gonorrhea testing. 2. CDC-required NAAT testing. 3. Reporting. 4. Treatment, follow-up, and classification. 5. Turnaround times. For more information, visit www.cdc.gov/immigrant-refugee-health.